Hi, as an ex-smoker, I started doubting my decision to quit smoking after I read an article in my local newspaper which referred to a study conducted by a group of researchers at a hospital in France. Their study claimed that amongst the coronavirus patients at that hospital, only 5% of them were smokers, whereby the ratio of smokers amongst the adult population in France was much higher than that. Therefore, it must have been the case that smokers are less likely to suffer from the virus. Rushing to conclusions, the study was expected to catch the attention of millions, and so it was published, shared, forwarded, and spread. But let's remember that these results were based on statistical claims that could have been doubtful. So before I gave in to the news to start smoking again, I gave it a second thought and decided to evaluate this study from a statistical perspective. Statistically speaking, the study utilized a sample of 482 patients, which was to represent a country of 67 million. And apparently, there is this thing in statistics about the sample size, which tells you that if the study is to represent a very large population and the sample size is small, it is quite possible for a small sample size to show something which is truly not the case just by luck or a coincidence. But for a moment, let's assume that their study was statistically robust, that it passed all the statistical tests, and the correlation which they found was statistically significant. So we still have a series of questions to ask, and I could not help but come up with a few what-if questions in my mind that might have been the case for the results to be in a certain way. What if smokers in France were less likely to visit hospitals and clinics for checkups compared to non-smokers? We know that the virus affects all of us in different ways, and many of us can recover from it by just taking care of our health and immune system. So when the smokers would show some of the symptoms, including a cough, they might have regarded it as a smoker's cough, which is pretty common. So they might have just gone to the clinics and hospitals in less numbers. What if the ratio of smokers in the adult population of France had recently reduced after the outbreak, and this reduction has not been accounted for in the study, so we are still comparing it with the old figures, whilst the total number of smokers have dropped as a precautionary measure taken by people who are becoming more and more concerned about their health? What if the patients had a smoking history with high vulnerabilities, yet as recent quitters, they no longer classified as smokers? What if smokers were more likely to be isolated from others before the coronavirus social distancing measures, as it could link with depression, anxiety, and loneliness, so they didn't interact with as many people as non-smokers? What if it was the case that smokers naturally kept a distance from others to prevent harm to them through passive smoking? So it could have been the distancing and not the nicotine that happened to be the savior in this case. So whenever we see such news which shows promising numbers, let's view it with greater skepticism. It is much easier for such studies to make headlines because the viewers are naturally more curious about such studies that go against our expectations, and we naturally want to know more about it. As a response to this study, many people in France wanted to buy more and more nicotine products because the study shows that they would probably be less likely to catch the coronavirus because of it. But this isn't really the case. So the government interfered and they imposed a ban on the sale of nicotine products online and restricted limiting its sale over the counter at pharmacies in terms of nicotine patches. The global research community responded to this study, and they explained how dangerous could it be for a person to catch the virus yet have a weakened immune system because of smoking. However, unfortunately, these findings might not make headlines as the previous study did, because it simply just keeps on referring to the fact that we already know, which is basically that smoking is bad. But let's not forget that every year smoking kills at least 8 million people, which is 30 times larger than the number of people which the coronavirus has killed in total since the outbreak. So if any of you ex-smokers are having second thoughts about the doubtful benefits of smoking, please let them go, and your future self will thank you later.